Hi there, it's Gabrielle Nicolay from SpeechKids, where we teach little kids to talk and help parents understand their little kids. And today, I'm so happy to be talking to my friend Laura Kiger. You changed your last name.
Colburn now, actually, yes.
Laura Colburn. Laura, tell the good folks who you are, what you do, and what specialty you have.
So I am also a speech language pathologist, and I also am the clinical director of our Kensington branch of our clinic, which is called Express Yourself Therapy. So we offer speech and occupational therapy, and I specialize in the DIR Floortime model. So that was what I wanted to kind of chat about today.
Awesome. And so tell us, what is DIR Floortime? What do we do with it? Why do we have it?
Absolutely. So I figured the easiest way to kind of break it down, there's a lot of different avenues, and I thought the easiest way would just be to talk about what D, I, and R stand for and what we mean when we say floor time.
Perfect.
So we'll start with D, which stands for developmental. So the DIR floor time model uses a developmental framework to guide our treatment. And basically what that means is we refer to what we call a developmental ladder. So it's kind of it's a ladder of different developmental skills, and starting with what we would expect to see in newborn babies who are typically developing. So, and then it builds all the way up to what you would expect to see in adults. I mean, some adults are still working on some of the skills on the ladder. So the very first developmental capacity that we look at is called regulation. This is a really big one that we could probably talk about for a long time.
Days and days.
But basically, regulation refers to the ability to just maintain a calm, alert, oriented state where you're able to take in what's going on in the environment around you and just kind of be alert and oriented. And
I'm going to stop you there for just a second, because it's as you know, but I'm going to explain for the folks who are watching. This is a really basic underlying skill that is underneath the ability to do anything else. And so oftentimes families are coming to us saying, we've got major behavior problems, for example. Oftentimes that regulation piece is what's causing the behavior. The behavior gets layered on top, but the regulation is what's underneath. I just want to clarify also, DIR floor time is a therapy modality. It's a way of doing therapy for kids who have a variety of diagnoses, but mainly autism. Would you say that's fair? Or
yeah, it was developed kind of with children with autism in mind, but I've gotten to the point where I'm using pieces of it with every kid that I see, even my articulation kids.
Perfect. And because I'm going to let you keep talking in a second, but because of the DI and the R, right, that developmental piece is huge. We gotta walk these guys through the developmental sequence if they're not doing it themselves.
Exactly. Yeah. And I think that one thing that people struggle with sometimes is, especially speech therapists, is wanting to kind of jump ahead in development and paying a lot of attention to a child's age rather than where they are developmentally. So you might have a client come in who's going into kindergarten or who's 8 and is nonverbal, and there's a lot of pressure to focus on words. You know, we want them to talk. When are they going to talk? And I think that tends to be something that therapists feel pressure for themselves. And I think parents, obviously, that's one of the more salient things that parents can see is speech. So a lot of times it kind of causes people to jump ahead, I think, and start working on talking before we've actually gone back and helped out with these more foundational skills.
I've done this before in trainings where to demonstrate even just sort of things that go before talking, right? Where I'm delivering a lecture look like this.
Yes.
People are like, oh, that's really weird. But it gets people understanding how much more there is to communication than just saying words. And it's not anything that anybody except, you know, we who choose to think about it really thinks about, because it's so automatic.
Yes, exactly. Yes. And I mean, there's a lot going on beneath the surface. There really is. Like, regulation is just the very, very first thing. There's also just engagement is the next one. So just tuning in with another person, sharing joy with another person, you know, just sharing attention with the other person is the next skill that comes in the ladder. And then two-way turn taking is the one after that. So just kind of starting to develop like a back and forth rhythm to an interaction. And it doesn't necessarily have to include words. It can just be, that mom kisses the baby and the baby smiles, and then so mom does it again and the baby smiles again. Just it can be just really simple things that are just establishing this foundation for what will eventually become that rhythm of back and forth communication when we have conversations.
Yeah. And do you still talk about circles of communication?
We do. Mm-hmm.
So we open the circle by doing something. Somebody opens the circle by doing something, and the other person closes the circle by doing something else, right? And
Exactly.
those then become a very,
Chain.
very long chain reaction
Yeah.
of loveliness, as I call it.
Yeah. Yes, absolutely.
Yeah.
I love circles of communication, and yeah, you start seeing it in pretty young babies when they're typically developing. So, like an example of that could be, well, we have a ball pit in our clinic. So we might put a little guy in a ball pit, and they really like it when I like shake the balls around really crazy in the ball pit, and then I stop. And us opening a circle of communication could be as simple as like them looking at me, or doing like a tiny little kick with their foot, or anything, a giggle, anything. And then that indicates to me, okay, they want me to do it again, and then they would, and it can keep on going and going. And that eventually can turn into more complex types of circles of communications, and eventually into having a whole conversation. But without establishing all of these really important foundational skills, what can happen is it is possible, of course, to teach a child to use words before they've established all these foundational pieces. But then sometimes you might see a child who doesn't really understand. They're not intrinsically motivated to communicate with others. They don't want to communicate with others for the purpose of just interacting with another person, or commenting, or just sharing something with another person. They've kind of learned to use words to accomplish their wants and needs. So they've learned that they can say this and they get what they want. But we're missing that part where they're using it like to connect with other people.
Mhm.
And if we go back and work on these earlier skills, then we can really help them kind of get there and kind of realize, hey, it can actually be really fun to let somebody else into my world. And now I want to use the words to communicate with you and to share ideas with you.
And I think this is where parents of kids who are experiencing some developmental issues really get tripped up, because they're trying so hard. They try and they try and they try, and they don't feel like they're making progress in getting into the child's world, or they don't even know how to start trying. So it's this sort of, parents are feeling a lot of failure sometimes to engage with their kids. They're blaming themselves. How many times have you had somebody come in and say, I think it's my fault because I don't interact with him enough, or I don't say the right things. And I always tell parents, it's not your fault.
Right.
This is internal to them.
Yeah,
but it is the kind of thing where you might want to get with somebody who knows the developmental sequence, who can take you down all the way to the basement and start building that foundation where it needs to be built. I want to make sure we have time for the I and the R. We could be here all day.
It's one of the most exciting ones. So I tend to get stuck on that one, but let's make sure we move on to the I. The last thing I wanted to say about D2 was also working with kids at higher levels. I just wanted to note that even those kids sometimes need to go back and work on the lower levels. I can be working with a child on just saying their R, but they can still come in one day and be really dysregulated. And knowing everything that I do about DIR Floortime allows me to recognize, okay, you are not regulated right now. We can't really start working on your R skills until we find a way to help you warm up and feel comfortable and get regulated. So I use it with kids at all levels. And it's not, once you achieve one capacity, it's not just that you're done and you never have to go back to it again. We're constantly kind of going up and down this developmental ladder as well.
Well, and this is what I love about you as a therapist, and it's very much aligned with the way, the reason we love each other is because we have a very similar approach to the kids, which is exactly what you're saying, which is, unless you are calm and in connection with me, I can't teach you to do anything. I can't force you to talk.
Right.
Or I can't even really force you to communicate. Yes, okay, I can like make your hands do a sign, and maybe that's going to be fun, but not if you're in lockdown mode and or in this state of, I love this, the flip, Dan Siegel's flipped lid.
Yeah.
If you're in protection mode, you're not learning.
No.
And for sure, you're not connected. That bridge and that, sort of drawbridge is closed.
Exactly.
And so going back, even for your typically developing R kids, for example,
Yep.
yeah, is hugely important. Or you might just as well cancel therapy for the day.
Right. If you're not, sometimes it's
no.
just not gonna happen. Yeah.
Yeah.
Anyways, I will move on to the I. So I stands for individual. And this part is about the fact that we want to take the whole child into account and all of their individual differences. So we want to look at the entire child's profile. We want to understand not only as speech therapists their communication skills, but we want to understand their sensory profile, things that they're reactive to, how their self-regulation is. We want to know about their visual spatial processing, their auditory processing, motor planning skills, all these different pieces. There's tons and tons and tons of things to that I could go into here, but we want to understand as much of their profile as we can so that we can adapt therapy in a way that's going to be best suited to them.
And I'm going to jump in here again. Sorry, I keep interrupting you.
Yeah, no, I love
it. I often get this question, what does that have to do with speech? Right? And it is back to this whole notion of, if the system, and we exist, right, in our bodies, we have our brains, and then I kind of, and the research is, sort of slowly bearing this out, that our cells, as distinct from our bodies and our brains, right, we exist in this package. If this package is not functioning optimally, then nothing functions optimally, right? So if we're asking a kid who has motor issues to walk and chew gum at the same time, oh my God, no. Or walk and talk at the same time. Now, sometimes that works really well, and sometimes that really doesn't work at all, but you have to know the individual child.
Exactly. And the flip side too, some kids need vestibular input. They need to be moving, or else they have a really hard time focusing. And I have kids like that, where if I try to make them sit still and work on something, it's going to be really hard to get anything done. If I let them move and we find ways to incorporate movement into our session, that could be like doing an obstacle course, doing anything that lets their bodies move around, then we're getting way more accomplished. And that can be true of little guys too. So if you're trying to work on getting some engagement or something from a little baby or somebody who's working at those levels, if they're someone who wants that kind of movement type input, if that's what helps them feel regulated, then putting them in a swing, and just kind of having them feel their bodies moving while we're interacting there, that's going to help them be regulated so that they can move up and we can start working on that engagement piece. So
I'm just thinking about dads and moms, but mostly dads, who are throwing their babies up in the air, right? There's a reason.
yes,
there's a reason we do that.
And you see children's eyes light up when their parents do that.
Absolutely light up, because we're stimulating the brain in the way it needs to be stimulating. We're experimenting with movement. We're experimenting with touch. We're experimenting with eye contact, and all of that is happening simultaneously. And it looks like such a throwaway moment. It's for my enjoyment as a parent. No, that's like brain development happening.
I know. It's pretty amazing. And yeah, we could go on with tons of examples. Another one that I think is an important one for a lot of kids is quite a few kids have auditory sensitivity. So, people, when they come in and they want to play or interact with a child, a lot of times think that they have to be really enthusiastic and big and loud and exciting. And for some kids, if they're sensitive to auditory input, that's going to make them shut down, and they're going to have to work even harder to be able to interact effectively. So for those kids, using kind of a soft, gentle, more soothing voice is going to get us so much further along in therapy.
I just felt that when you did that, by the way. I literally just was like, oh.
It works.
It works every time.
But so if we just kind of have tunnel vision for the speech and language skills, then we can miss all of this stuff, and without knowing about it, it makes it so much harder to accomplish our goals and to help the child go on with their development the way we want them to. So, so the I is another very important one, but I'm watching the time, so let's move on to the R. So the R stands for relationship based. This is a really kind of central part of the model. It's focuses on just the critical importance of the relationship in driving development forward. So in order to encourage a child and guide a child to move up the developmental ladder, we need to have strong, positive, trusting relationships, not just us with the child, but most importantly, the parents and the families with the child. So DIR Floor Time really, really emphasizes bringing the families in, bringing the parents in, coaching them, helping them learn about all of these pieces of their child's profile so that they can adapt their, way of interacting if needed, and just find the best possible fit for how to interact with their child and grow their relationship as strong as they possibly can. So that's kind of the main crux of that part, is just the critical importance of relationships. What were you going to say?
No, I was going to say, and then comes the floor time piece.
Yes. And then comes the floor time piece.
Love this.
So this is where really all the strategies come together. We're pulling all of these things in that we just talked about into this very play-based therapy approach. So one of the biggest parts of it is that we're working to follow the child's lead. We want to kind of be noticing what the child is interested in, what makes them excited, what they're focusing on, and try to join them in that. So if a child is really, really interested in numbers, for example, rather than trying to steer them away from numbers, it can be really helpful to say, okay, I've noticed that you're passionate about numbers. I'm going to try to join you in this passion and see if there's a way that I can be invited into this world with you.
Mm-hmm. Mm-hmm.
So just kind of trying to get in, join them in their world, show them how fun it can be to include another person in their world with them. It doesn't have to be solo. We can make it so much more fun if you let me be part of it too. And then helping kind of challenge them to expand a little bit from there.
And this is that's a dance right there, because we need to, as the adults who have, sort of the knowledge and the competence, we tend to want to show kids things, right? We think that teaching is talking and teaching is showing, and you should do as I do because I know more about it than you do. And the fact of the matter is kids are learning best when they are self-motivated and self-driven.
Mm-hmm.
And when they are able to be the experts. And so what you're saying is, it makes perfect sense if somebody loves, and numbers is of course very common in some of the kids that we see, but kids who are, really, really stuck on numbers, if they can show us, right, if they have control over us as regards those numbers, and then we pull a little bit, right, we expand, but they get to be the expert and the leader.
Exactly. Yes.
And that's hard.
Mm-hmm. It is hard. It doesn't feel natural to us at first. It's a big learning process, really, to kind of get used to doing it in this way. And I, the parents especially, I think they haven't gotten to have all of this DIR floor time training. So that can be a long process to kind of help realize that, when you kind of switch the roles like that, the child can actually make quite a lot of amazing progress.
Well, I have seen you in action, and it is a joy to watch. So, it looks very natural, and I think anybody watching would be like, "Oh, that looks so easy. I could totally do that myself." And that's not the case, because obviously, number one, you're very good at what you do. Number two, you've had lots of experience doing it. But it is an absolute joy, and I think we're going to leave it there for now, which is so painful because I could stay here all day and talk to you. We'll do another one of these.
Thank you so much for having me on to talk about this.
Thank you, Laura. Take care.
So I love the opportunity to get on and tell others about it too.
Me too. Thanks so much.
No problem.